Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Doctors, on this program, what I want to talk about today is teams that train together, gain together. It's a really simple concept. In injury practices and injury practices that I consult, one of the biggest errors I think that doctors make is they don't realize how valuable, I know they've realized how valuable their staff is, but they don't realize how valuable their staff is in being able to get better injury results and being able to get better compliance and in being able to get better referrals, in being able to get better collections, in being able to get everything. When you train your staff and you take the time to train your staff on the things that really matter, which is the purpose and the whole goal of what you're trying to achieve in your injury clinic, which should be to take patients that are injured, especially ligament injuries, and to have the patient come through care 2 months, 3 months, 6 months, I don't care how long it is. They come through care and they have no pain, no problems at work, no problems in their life as a result of the injuries. That's the mission. That's the mission that each and every injury clinic should be doing. Now, the team that trains together gains together. Doing that and getting great injury results, getting great injury referrals, getting your compensation, reducing your insurance your insurance problems or attorney problems is a team activity. It's not a single activity. If you want to learn alone and you want to train alone, you'll succeed alone. And you'll have a much harder time with staff turnover and a lot of different things. So one of the biggest things that you can do in your injury practice, you got to train your people. You have to train your people. Now you say, okay, what am I training them in? Well, you got to train them. Hey, when a patient does a consultation, they better know what the key components of a consultation are. What are you trying to get from the patient in a consultation? When you're doing an examination, your staff should know exactly what you're trying to assess for. They should know it completely. I don't care if they're in your billing department, they're in your front desk, they assist you with notes, they're your office manager. They should know every aspect of what you're doing. When you do stress radiology, why are you doing stress radiology? What are you trying to find with it? What do the results mean? Your staff should be trained on every single one of those components. When they come in that first day, the first thing that any patient is going to interact with is your staff, right? So the more competent they are, the more confident they are. The more competent they are, the more helpful they are. So it's not just learning, hey, I've got this new scheduling system and learning how to schedule, or, I've got this new billing system and here's how you're going to bill. I've got this new EMR system. It's actually training them about why you're doing what you're doing and what you're trying to find with each and everything you're doing. When you do a re-examination, every single member of your staff should know exactly what you're doing. And they should know exactly what that patient's going through. So if that patient just came out and they just had a re-exam and they have questions on something because you've left the room. You're the doctor, you've left the room, and now they walk down the hall and they have 3 or 4 questions. Well, who are they going to get those questions answered from? Your staff. Now, if your staff is trained, then your whole clinical operation is like a well-tuned band. It's very organized. And it's very in rhythm, in sync. People that feel that, they really do. And they experience that. And when they experience that, the experience is much better for them in your office. So you want to train your staff. Now, the Smart Injury Doctors program that I developed, that's one of the biggest components is training your staff. We have checklists that go through each and every significant event that the patient is going to go through. When you're talking to the patient about an MRI finding, or you're talking to the patient about an excessive motion finding, how you express yourself matters, and how your team expresses themselves when they're getting asked questions about why did you do this test or why did you do that test. It matters. And the more tighter your group is, and the more tighter the communication is, the better the patient feels that they are in the right place. And you want your patients to feel like they're in the right clinic, right? Because when they feel that way, they get an experience that is far superior than if they're in a clinic that doesn't. That's what makes people refer. That's what makes people remember. It's when you're looking at these little details and you're training your staff on these details, man, it makes all the difference in the world. I know from my own personal practice of 17 years that made a huge difference for me, was training my staff, letting my staff know why we were doing what we were doing. I had a person in my clinic, I have more than one person, people in my clinic that can answer a question on just about anything. So that's where you want to get to with your clinic. You want to get to the point where your people can answer the questions that the patients are going to have, because who are the patients spending time with? They're spending time with your staff. Now, does your staff know what makes your clinic unique? Do you know what makes your clinic unique? And if you know what makes your clinic unique, but you're not teaching it to your staff, why are you withholding that? Right? Because you want to develop a clinic that is unique. That you want to start to differentiate yourself, and then you want to train your staff on how you're different. Because that difference is what they'll be proud of, actually, and it's what they'll be promoting. So you don't want to withhold that. You want to actually express it. And that's why, again, in the Smart Injury Doctors training program, that's why I emphasize so much, not training, again, on how to schedule or those things. That I assume that you're doing just fine. But on the aspects of injury care and why you're doing what you're doing, your staff has to know about that. And when your staff is really good at answering the questions, you will see better results. You will see better compliance. You will see less problems with insurance. And you will see more internal referrals. So doctors, don't underestimate the return on investment. The return on investment is through the roof when you train your staff. So you want to train your staff. And staff training is very, very important. I know in our program, I promote it, and we are starting to, in the program, the Smart Injury Doctors program, not recommending, but saying, look, if you want this program to work, you've got to train your staff, because it's that impactful to your clinic results, and your clinic growth. So definitely look at training your staff. It's a huge ROI for you in your clinic. Doctors, every time I do one of these programs, they're short, sweet, and to the point. If you have any questions, put them down below. If you have any comments, put them down below. And if you would, tell me what you're struggling with in your private practice today. Tell me what you're struggling with in your injury practice. Put the comments down below. We definitely look at them, and that's what I'll use to develop future podcasts. So thank you very much for your attention today, and I look forward to you on the next podcast. Thank you.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review, and don't forget to join us on our next program.